Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Blueprint Self-Management Workshops. Addressing the most common, costly, and preventable health problems is the goal of the Blueprint Self-Management Workshops that are offered throughout our community. Improving the health of our population is important in reducing overall healthcare costs. But what tools are available to assist healthcare seekers in learning how to manage and improve their own health? To discuss the Blueprint Self-Management Workshops in greater detail, I'm pleased to introduce this month's guests, and they are Deana Chase, Integrated Health Team Social Work Team Leader, and Rebecca Chaplin, Social Work Care Coordinator. I'd like to welcome both of you to the show this month.
Thanks for having us.
So let's start with Deana. Tell me what your role, or I'm sorry, Rebecca. Let's start with Rebecca. Tell me what your role is at NCSS.
So I'm a social work care coordinator. I'm employed by NCSS and I'm embedded in the pediatrician's office. So I'm embedded in Northwestern Pediatrics in the Enosburg and the St. Albans practices. And
Deana, if you could
Sure.
answer the same question for the audience.
I'm a social work care coordinator, the team leader for that team. We have about 12 social workers on the team right now, and they're all embedded in primary care practices as well as our new women's health initiative. So we have social workers now embedded at both Planned Parenthood as well as Northwestern OBGYN. And I just recently took on the role of regional coordinator for the self-management workshops, and Rebecca is one of the facilitators for those workshops.
And before we get into the workshops themselves, I think one of the interesting things that you've already both hit on is the fact of staff that are embedded in primary care practices throughout the 2-county area that we serve. Because I think that's so important when we talk about individuals over the years who have gone for their medical purposes to a primary care provider but might have been struggling with some sort of a mental health disorder, be it anxiety, bipolar, depression, and yet in those visits that would not be addressed. So the importance of having staff embedded in those practices and what that has meant.
Yeah, I think it was addressed, but addressed now more holistically, and the doctors and nurse practitioners, physician assistants now have the option to refer to someone else to be a part of the team, the care team with the patient, with them. So it's been really a really great program.
Yeah, that's wonderful. And me not being a clinician, the thing that I've always been excited about is the fact that I know there's a lot of individuals who would have been referred to NCSS by primary care providers, and many of those individuals would not make the call or would not come through the doorways of NCSS, where now they're much more comfortable being helped right in their own primary care facility.
Absolutely.
And
Yeah.
I think sometimes, waiting to get into NCSS for some of those services, so the fact that we can provide that bridging support and that gap of services until they are enrolled in, either the Children, Youth, and Family Division or in Adolescent Services or developmental services. So I think sometimes just being able to be that bridge can be really supportive for families.
So that now takes us to these self-management workshops. So can you tell me more about the Blueprint self-management workshops?
Sure. So there are several workshops that are offered within our health service area. We have the chronic disease self-management program, chronic pain self-management program, the diabetes self-management program. Then there's the YMCA's diabetes prevention program. And then there's our WRAP program, which is an acronym that stands for Wellness Action Recovery Planning. So those are all really programs that support people with any chronic condition. So people wanting to become more active in their overall health and wellness, they can create plans within any of those programs to do that.
And what are the healthier living workshops?
Those are all the workshops that I just mentioned. They're very, the chronic disease self-management is more focused with individuals with any type of chronic health condition. So it can be ranging anywhere from asthma to diabetes to heart disease, any conditions such as those, and really working on weekly action plans to kind of take more of a lead in their own, that's why they're called self-management. So more of a lead in their own wellness, their own health and wellness. And then there's the chronic pain workshop, which is chronic pain, anyone with either a primary or secondary diagnosis of chronic pain. And again, they learn techniques and tools, strategies for managing their chronic pain differently. And then there's WRAP, which is more focused on mental health. So individuals with any mental health challenges that may want to, again, learn tools and strategies to help manage that on their own and really create, it's called a WRAP plan. So really create a plan that focuses on all the tools that they need to manage their overall wellness and their mental health. And then there's the YMCA's Diabetes Prevention Program, which is a program that works with individuals that are at risk for developing type 2 diabetes.
So that one is for those who are at risk of developing it. So they have not been, they are not deemed to be diabetic yet.
Correct.
But they're on the continuum, so to speak. That
in fact, they can't be diagnosed with diabetes to participate in that program. However, we have another program which is called diabetes self-management. So if an individual has diabetes, they can be referred to that particular program and work on tools to manage the symptoms of their diabetes.
So the good thing about those two programs, and I'm just right now talking about diabetes, is the fact that not only is there the program for that person that is a diabetic already, but there are so many people that are on the cusp perhaps of becoming diabetic, and if there are ways that they can manage it, which is what this program is intended to do, the hope is they can avert ever becoming diabetic.
Absolutely, yep. And they're all evidence-based programs, so they've had great support, and we know that they work very well.
Now, Rebecca, you are the facilitator for the chronic disease self-management program. What do you like best about that particular program?
Yeah, so I definitely believe that the self-management workshops, change lives by supporting individuals and giving them the skills and tools that they need to become active managers of their own lives when they're dealing with their chronic conditions. The excitement of, witnessing people become more confident in themselves and increase their engagement in activities that they once enjoyed and maybe aren't enjoying, today is really amazing. learning. So I feel like these workshops are not only fun, but they're really interactive. And I think that that's really great for participants to come into a room and to know that, everyone's there for some of the same reasonings, and we just want to be there to support each other, and it's a great way to do it.
Right. That's one of the great things about it. There's an opportunity for mutual support and for individuals to become supporters of other individuals where they might not have had that opportunity otherwise.
Yeah, I would imagine they probably do meet a certain number of people that they may not have just in their daily lives that are dealing with the same scenario. And I could see where they could almost become collectively outside of the workshop friends, now trying to support one another in a variety of ways.
Yeah, that peer support is so important.
And sometimes just being in a room together with other people that are going through the same thing can be really empowering.
Yeah, well, it gets back to that scenario of the people are not alone. I mean, I know a lot of times somebody gets diagnosed with something, they feel as if perhaps they're going to be alone and no one will understand their particular situation. But it's nice to know that there are others that can, can really help to support them, who know what they're going through.
Absolutely.
Absolutely, yeah.
Now, what do you see patients getting out of the program from their perspective?
Yeah, so I think that the self-management workshops empowers individuals as self-managers through the education and support and skill-building exercises. The fact that they can set goals and through problem solving. Individuals who are living with chronic conditions, including asthma, heart disease, lung disease, and diabetes, experience some of the same symptoms, including fatigue, irritability, feelings of anger, depressive symptoms, difficulty with sleeping. And it's kind of a great place for everyone to come together, even though they're maybe there for different reasonings, that they have those same struggles, and a place where they can share what those barriers are and what their successes are as a way to motivate and empower other people who are in that same kind of position maybe that they were in. So very much to what you were just speaking to, that it's a great place for them to conjugate together and to realize that they're not alone, and a great way for them to be able to teach each other what got them through a difficult time.
And we talk about the workshops and people coming together. On average, what's the length of the duration of these various workshops?
Sure. So the chronic disease self-management, the chronic pain self-management, the diabetes self-management, those are all once a week for 6 weeks. They are 2.5 hours each week. And then the YMCA's Diabetes Prevention Program is a 1-hour workshop per week, but it's 16 weeks long. And then following the 16 weeks, it goes to biweekly and then monthly for the duration of an entire year.
Okay.
And then the WRAP program is 24 hours worth of material, and we can kind of break it down however we see most useful to the community. And what we've learned after offering these is that usually the 4 days of 6 hours of workshop at a time works the best. And so that's how we've been offering it, but we can break it up differently than that as well.
I see.
Yep.
Now, how would someone go about getting more information or signing up for the Healthier Living workshops?
Yep. So they can call the NCSS main number, which is the 802-524-6554 number, or they can reach out to me directly, and that's 802-370-5626. We'll be having advertising in many different locations. People can find out about the workshops through their primary care provider's office. Our entire team works in almost every primary care setting in this area, and so we'll have flyers out when there are new groups coming. We hope to have a year-long brochure in the waiting rooms. Facebook. There's this program as well. You can find out more about them. So we're doing all kinds of things to make sure and get the word out to people.
Now, for someone to participate, does this have to be a referral from a doctor?
No, it does not. The referrals can come from the patient themselves. It can come from the primary care provider. It can also come from a self-referral or through the community health team who are embedded in the pediatrician's offices or in the primary care
Yep, basically any way. If you learn about it from a flyer, you can just call the number on the flyer, or your doctor can refer you, or one of the social workers at the office can refer you. Anyway, any number of ways.
Is there a maximum number that any of these workshops have to cut off at as far as number of participants?
We like to have a minimum of 10 people signed up, but depending on the size of the room that we're holding it in, there really isn't a maximum. It just based on the size of the room, basically.
Itself.
Yeah.
Okay. But you like to have 10, though, minimally to effectively run.
Right, because we know that that's most effective in a workshop setting for people to have mutual support of one another.
Sure.
But if 10 are signed up and 6 people come, that's okay. We'll still run the group.
Now, is there an age range for participants?
Yeah, so currently the self-management workshops support individuals who are 18 years of age and older.
Yeah, at this point.
Yep.
Now, let's talk about where these workshops are being facilitated, because you had mentioned earlier that it isn't as if they're all being done at a central location, that it's pretty much spread all around. So I think it might be nice for the viewers to know how broad reaching is this and what types of locations are going to be hosting.
Sure, our goal is to have the workshops spread throughout the entire health service area, which includes all of Franklin and Grand Isle counties. We hope to have them in as many locations as possible. Sometimes we hold them at primary care settings, sometimes at community settings, such as some of the SASH sites in the community. So sometimes at the hospital, sometimes at NCSS. We have one that's going to be going on at the Richford Health Center coming up at the end of August, a chronic disease health management program. We have one at our at Northwestern Comprehensive Pain that'll be held also at the end of August. And then we have one at St. Albans Primary Care that's going to be coming up also at the end of August.
And then we'll have one at Georgia Health Center.
Yep, in October we'll have one at Georgia Health Center. So we're trying to spread them out.
Sure.
Yeah,
Well,
so
I think
people
that's
can access them.
I was
Sorry,
going to
John.
say
Yep.
that. No, that's what I was going to get at, is the fact of access, because if everything was being held in St. Albans and you have individuals, say from Richford or Enosburg or Alburg for that matter, who say, I have a difficult time, making those times and dates and what have you, but having them all over the two-county area.
And we know that transportation can be a barrier, so having that access in those rural communities where there is a need is beneficial.
Sure. And the other thing to note about transportation is that Medicaid does transport for the Blueprint workshops. So just notifying ahead of time, the 48 hours notice for transportation. So if an individual receives Medicaid benefits, then they can call for transportation for these programs. The only snafu we found with that is when we run the programs in the evenings, and those rides are not offered after those hours. So, but we will work with people to try to figure out transportation for sure. If that's a limitation for someone, I would hope that they would call me and I could try to help them with that.
And the reach up support as well, the benefits,
absolutely,
right?
Yep. So reach up participants can access transportation as well, and reach up participants can count this towards their goals of the hours that they need to achieve as well. And they can talk more to their workers there.
As to figuring out all the details.
Absolutely.
But that was a very important point, though, because Rebecca, you're right. I mean, transportation for a lot of services is a barrier in our region, being as rural as we are. For sure.
Yep.
Now, what kind of commitment is asked of the participants themselves in any of these programs, or if you want to break them down? Because I would imagine, there's one thing to show up, but then what is that commitment beyond the fact that you show up for X number of weeks or X number of hours?
Sure. So I think really the commitment is just to be an active participant in your own health care. So, so while you're at the workshop each week, you'll set up an action plan. And that can be something as simple as this week I'm going to do some research on my condition. And my confidence level in being able to do that is out of between 1 and 10, my confidence level is a 7. So our hope is to have everyone's confidence level be a 7 or above when they're setting up action plans. And if it's a 7 or higher, then we know it's pretty likely someone's going to follow through with what their action plan is. If it's not, then the facilitators and the rest of the group will help the individual come up with maybe alter that action plan to support them. And it's a very empowering workshop. All of the workshops are very empowering, but I've been a leader, so I get excited about the workshops because I've seen how effective they can be and seen how participants come out of there feeling really, really empowered and really good about their taking charge of their wellness.
Yeah, they are very interactive, and so being able to share those ideas and supporting those who may have a challenge in coming up with their own action plan. And so sometimes being able to hear what other participants are choosing to do might, trigger a thought for them of, oh wait, yeah, I wanted to go out and plant a garden, or I wanted to take a 5-minute walk, and I'm going to set my timer to do that. So it's all about that interactive piece and that peer support piece.
Well, I would imagine the other thing that's very important that I think people need to understand before they would ever step foot inside is that these are individualized programs, because everybody does not have the same goals, they don't have the same timelines, but it sounds to me like with what you're doing is that it's very specific to an individual, to what their goals are, and then trying to keep them on track to achieving those so that they don't feel defeated.
Right. That's really the number one strategy in developing an action plan, is that it has to be something that you want to achieve. Can't be anybody else. Can't be what your doctor wants you to achieve.
Sure.
It has to be what you want to achieve. And then you'll find that you'll be much more effective.
Well, and I think, the overriding factor of all of these workshops is the fact that there's a lot of people who really, for their own long-term good, need to come up with self-management plans to try to counteract either a condition they currently have or one that they may be susceptible to if things don't change. And I think so many times people forget that it's not the doctor that's deciding on what is or isn't going to be good for them.
Right.
If you know what I mean. I mean, the doctor can't say and do for an individual. They can tell you that something may be good for you, but unless you take the initiative, things aren't going to change.
Yeah, and I think that the workshops are very empowering in giving participants their own voice to be able to say, this is my goal and this is what I want to work on. It may get me to where my provider wants me to be, but I think that it's opening that door for that possibility and opportunity for that participant to advocate for themselves.
Yep.
Now, I would imagine over time, and I don't know how long the workshops, other than RAP, that we have been involved with for years, the other workshops have been available. But I would imagine that over time we'll be able to look at some outcomes and see to what degree these have made a difference in people's lives. And, again, I know it's going to be to varying degrees, but I would imagine that that'll be something that'll be exciting to look at as you go forward.
Absolutely, yeah. Outcomes, yep.
Because I know, as we all know, that certainly NCSS has been a leader in looking at outcomes, and which, from a healthcare perspective, certainly is critical, because you want to hopefully make a difference in people's lives, and until you start to measure certain things, you may not really realize to what degree you're having success.
Right.
And I think that's where being embedded in the primary care offices is really helpful, because we can help support those patients, if appropriate, outside of the workshops, and help them maintain, their action plans if appropriate.
Yeah. And several of the social workers, including Rebecca, on our team are trained as facilitators in these programs. So again, like she's saying, they can work with patients to follow through on their action plans and or support them in any way that they may need further support.
And that's an interesting point, is there's a variety of different facilitators for all these various programs. And Rebecca, how many different ones are you involved in?
So I'm going to be co-facilitating two, one in August and one in October. So at the Richford Health Center and at the Georgia Health Center.
And Deana, you are?
I was a facilitator. I'll probably just be subbing at this point if anybody is out. But there are various workshops already set up for almost, I think, the entire year from now until next summer, early fall. So we have at least 2 RAP programs that are set up throughout the year. We have 3 YMCA's diabetes prevention programs set up throughout the year. We have multiple chronic disease self-management workshops set up because we have multiple facilitators in that group. And then we also have 1 diabetes self-management program and 1 chronic pain self-management program set up. So we have multiple programs set up throughout the year, and that'll be ongoing. We'll have a flyer that advertises all of the programs, and then as each one comes out, we'll have individual flyers for each one as well, and hopefully be talking about them throughout the year as well in various different ways.
Well, it sounds like a lot of great things that are going to continue to happen for our community. And I want to thank both of you for being here. Believe it or not, our time is up.
Thank you.
So I want to thank
you.
my guests, Deana Chase and Rebecca Chaplin, for being on the show today and sharing their insights on the benefits of the self-management programs that are available to assist people with improving their health. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.